welcome everybody. Thank you very much for joining us today for this IBMS Support Hub. We're really happy to be joined today. Tahmina and I are being joined by Sheri, who's going to talk to you about sustainability, and Jim is in the background in case we have any technical hitches, but hopefully we'll be okay. So welcome everyone. Really nice to see you on this gorgeous sunny day. Thank you for making time to be here at your lunch break or taking a break from the lab or from your studying. We're going to talk about sustainability. And it's the same panel as always. As I said, we're joined with Sheri, who's really passionate about sustainability, and she's going to tell us all about it today. So before we start, just to let you know on the webinar settings, your camera and microphone will be turned off if you've not joined us before, but we can unmute you if you want to ask a question later. On the bottom of your screen, you'll notice there's a Q&A button next to participants. If you want to pop any questions or comments into that, I'll monitor that as we go through. And then the next one along, you'll see there is a polls button. I'm going to launch a poll, and that's going to ask you a few questions just to give us a bit of an idea of who is in the room and a few questions about who you are. So to participate, you need to click on the polls button on the bottom ribbon on your screen, on your PC device, whatever it is that you're using. I can see people are starting to vote. That's brilliant. So if you click on polls, the poll will appear and you just need to answer the question. And then we can move on and we can go through the other questions as we go through. So there should be 5 questions that appear. The first one is, where in the UK are you based? The second one is, what is your job role? And you can tell us what that is. You can type in an answer to that one. Number 3 is, what's the main reason for your attendance today? And again, you can just type in free text to answer that question. Number 4 is, have you completed any mandatory training in the workplace about sustainability in the context of lab work? And then for the last one, I think you've got a choice of 1 or 2 for number 5. So if you want to work your way through the questions, I can see who's answered the questions as we go through. So I'm going to give you a few minutes at the start just to answer those polling questions. If you've just joined us, colleagues, what we're doing is completing a poll. So if you put your cursor onto the screen, the middle icon that you can see next to participant and question and answer is polls. If you click on the poll button, then you'll be able to join in and answer the questions in the poll. So we're just asking where people are from, what kind of role you have, what's the reason for you attending, and what do you know or what training have you had in sustainability? So I'll give people another minute or 2 to fill that in before I close the poll.
So it says that there's polls not working for some people.
Oh, okay. I can see some people have answered, only 7 people have answered. If they clicked on the poll button at the bottom, so you need to click on that to enter, can people get in but it's not working? My poll has disappeared. That's interesting. I don't think there's anything that I need to do.
If you're using this on an iPad, you should just be able to scroll straight through.
Yeah. I don't want to relaunch. No, it started answering, but it's disappeared. That's strange. Shall I relaunch?
Try that and see.
It seems to be going up now.
Yeah, that was odd, wasn't it? It sort of froze. It didn't time out, did it?
Unsure.
I'm watching, it's got seconds on, unless it's timed to be a minute or something. So I can see people are answering question 1. Some people have answered question 2, but there's only 3 out of 10. Oh, that's starting to go up now as well. That's good. Brilliant. So I can see, hopefully people have got access to the poll and it's working okay. I can see 14 people so far have answered the questions. So we'll give it another minute or so.
Love how everybody's answering untitled question number 5.
I wasn't sure what untitled question number 5 was.
No, I'm not quite sure what untitled question number 5 is either, if I'm honest.
Okay, so David's just said, I think we're clicking submit without scrolling on. So it closed after the first question.
Oh,
so that might be it. So Yeah,
Organise
if you're on
something
an
called
iPad, you might need to scroll down and answer all the questions and then submit after you've answered them all. That may be why it's turned off. Cyber says she can't access the poll. Don't know why. Okay, we've got 21 people answered who are on. So are you happy for me to end the poll? So we've got plenty of time to get through the content that you want to present, Sheri.
Yeah, absolutely.
Yeah, lovely. Thank you everybody for participating in the poll. Sorry for any glitches. So I'll end the poll and I will just close that and we'll look at that later. If you have got any comments or questions, please do pop them into the chat. Into the question and answer boxes as we go along. I'll start monitoring that. I'm going to turn off my mic and mute, and I'm going to hand over to Tahmina to start the session formally. Off you go, Tahmina.
Thank you, Sue. Next slide, please, Sheri. Thank you. So yeah, today's session will be focused around sustainability, but just to give you an overview of the kind of things that we'll be covering, well, Sheri will mainly be covering. I'll start off with giving you a brief update on the wording in the QAA subject benchmark statement. And then Sheri will talk a little bit about the relationship between the climate emergency and public health, and some of the concepts of SUSQI, as well as going through some case examples of embedding sustainability into practice. Next slide, please, Sheri, thank you. So I don't know if many of you are familiar with the QAA subject benchmark statement, but there's been some updated wording, and it's basically around sustainability and sustainable development, which are key considerations in biomedical science and or biomedical sciences programs. It's about managing Earth resources to promote the long-term well-being of the planet and all of its inhabitants. It's important to know that sustainability isn't solely about the environment. It's an ongoing process of addressing social, environmental and economic concerns to create a better world, and as such has a particular relevance to biomedical science or biomedical sciences. So some of these considerations that we might think about are reducing paper use, the LEAF initiative for improving sustainability and efficiency of labs, and the discussion of ethics and environmental impact of laboratory work. Things like replacing chemicals with sustainable alternatives if possible, and considering glassware in place of disposable plastic. Also looking at raising an awareness of reducing waste, bioremediation, careful use of non-renewable resources, alternative energy sources, and pollution control. Also looking at assessment design as well. And I can hand over to you now, Sheri, thank you.
Thanks very much, Tahmina. Thank you, Sue, and thanks for inviting me today. So just to give you a bit of an idea of my background before I talk about sustainability, I've been a biomedical scientist for over 21 years. Now I teach full-time at Nottingham-Trent University, but I'm still very much active in a professional capacity. So I'm a fellow of the Institute of Biomedical Science, and I'm also a council member. So I'm leading sustainability through my council role with the IBMS. In addition to that, I have also got a role as a task force member for the European Federation of Clinical Chemistry and Laboratory Medicine. And I'm also a lead on the Clinical Labs SUSNet site, which I'll talk a bit more about during the presentation. So it's pulling all of this together that allows me to present this today. So before I talk about what sustainability is, what we can do in the lab, I just want to play this very short video from the Lancet Countdown, which nicely summarises why we need to consider sustainability.
The health of everyone alive today is being threatened by a persistent fossil fuel addiction that is accelerating climate change and amplifying the harms of the simultaneous crises we face. As climate risks escalate, action to ensure a livable future can no longer be delayed. The Lancet Countdown brings together researchers from around the world to track the health impacts of climate change and the health benefits that will come with accelerated climate action. This year's report shows that all the impacts we monitor are rapidly worsening. Exposure to life-threatening extreme weather events is accelerating. Heat-related deaths among older people have increased by 68% over the past 20 years. Climate suitability for the spread of infectious diseases such as dengue and malaria is rising, and food security is being compromised, with more heat waves resulting in at least 98 million more people lacking access to adequate food than in previous decades. This is putting additional pressure on health systems as they continue to grapple with the devastation of the COVID-19 pandemic. Now, the over-reliance on fossil fuels leaves households vulnerable to the rising energy prices, and the slow adoption of renewables leaves millions exposed to dirty fuels in their homes. And while oil and gas giants are making record profits, a just, healthy transition is undercut by a lack of funding, and governments still allocate hundreds of billions of dollars to subsidizing fossil fuels. Regardless of claims and commitments, the strategies of the largest oil and gas companies would lead to emissions vastly exceeding levels compatible with a healthy future. It doesn't have to be this way. In our response to the concurrent crises, we have a new opportunity to prevent the worst climate change impacts and deliver a healthier, safer, and more equitable future. By redirecting efforts towards rapid and just climate action, people around the world could also feel immediate health benefits. Shifting away from fossil fuels could save 1.2 million lives annually from cleaner outdoor air. Greener, energy-efficient cities could benefit people's physical and mental health, and climate change adaptation could deliver more robust health systems better prepared to cope with future infectious disease outbreaks and climate shocks. The time to act is now. Decision makers must take bold actions to deliver a low-carbon, resilient future where people around the world can not only survive, but thrive. Visit the Lancet Countdown online to find the latest assessment of the state of health and climate change in your country.
So there are stark warnings there. There is a lot happening that we need to be concerned about, but there is also a lot that we can actually do. So what I want to really talk about is that because of these stark events, this climate crisis, where we're seeing increased heat waves, flooding, drought, we're seeing record-breaking temperatures and records in weather phenomenon every day in the news. We have a responsibility to act, because that climate change is affecting health, and health affects our practice. So what can we do? Well, we need to think about sustainability. We need to have a look at how the heat-related illness and death is being affected by the rising temperatures. So what can we do about that? We need to think about the impact on health from increased allergens and the changes and increase in disease spread, so that we can then make changes to our practice to try and mitigate these effects. And this is where sustainability comes in. Sustainability is about the balance between equity, environment, and economy. So it's not just about climate action, but it's also making sure that we incorporate equality, diversity, and inclusion to our practice, thinking about our quality education. And these are all linked together under the United Nations 17 global goals. And these global goals is where our carbon net zero objectives have come in with the NHS. It's where we've got sustainable management plans come in, looking at our employment strategies with the NHS. And it's where I'm going to be concentrating at looking at where we can change our practice to make an impact. So where does sustainability fit within the NHS? Well, I'm going to briefly discuss the Sustainable Development Management Plan. So this encompasses work experience. It's looking at where we can incorporate apprenticeships so that we've got more opportunities for society. We've got, it's quite an ambitious plan, and it's about meeting the diverse needs of the people and making sure that there are future opportunities to incorporate personal well-being, social cohesion, inclusion, and that equal opportunity. So it's balancing those different needs and thinking about that environmental, social, and economic requirements. There's also the Greener NHS, which is the plan to tackle climate change. And I'll be talking a bit about the work I'm doing with the IBMS and the Greener NHS to promote education for the clinical lab. And also we can consider getting it right first time, which is looking about how we, the clinicians use our medical services. It's reducing error rates, and also making sure that we utilise point of care and making sure we do get those right results for the right patient at the right time by the right methods, and they may be more sustainable. So let's think about reducing that carbon emissions. It's about getting that net zero objective. There were a number of early steps. So the Green NHS developed this framework, and it meant looking at medicines and supply chain. It meant looking at transport and travel and looking at greener forms of transport. It's thinking about innovation. What can we change for quality improvement that has that environmental benefit? And it's looking at our hospitals, whether that's the infrastructure such as heating and lighting, or adapting the way we practice, and looking at the governments. And last year, in July 2022, it actually became legislation that we start thinking and acting for climate improvements. So when we talk about climate, we often talk about the carbon footprint. And I'm often asked, what is the climate footprint? And this very short video really summarises in an easy to understand way where that climate footprint comes from.
The Simple Show explains the carbon footprint. This is you. You've probably been hearing a lot about climate change and how you should reduce your carbon footprint. But what is that exactly? Just like an actual footprint, it's a mark you leave upon the environment. No, not with your shoes, but with every action that releases carbons. Those are the harmful gases, such as CO2, which are pumped out by burning fossil fuels like oil or gas. The more fuel you use, the bigger your footprint will be. You may think that by driving your car, the only carbons you release come from the engine, but no. Consider the carbons that are emitted just to get fuel into the tank. From the energy needed to extract the oil from underground, the pollution caused by transportation and refinement, to the final delivery to your local petrol station. Not to mention the CO2 released by manufacturing your car in the first place. More than you thought, huh? So unless you live in a cave, you and everything you own has its own carbon footprint. Read a book? Printing and distributing. It uses energy. Brush your teeth, and your utensils will have a history in a factory. Even something as basic as an apple could have traveled hundreds or even thousands of polluting miles to end up in your local supermarket. You see, it's pretty much impossible to leave no carbon footprint behind, but that's no reason to stop trying. Think about your actions and choices, and you'll be able to reduce your personal mark after all. That's how you really put the boot into climate change.
So what I find with that video is it really explains that everything we do impacts on the carbon footprint. And it's not just what we do and what we use, but it's thinking about that, the life cycle, where it's been produced, how it's got to us. If you want to have a bit of a go at assessing your own carbon footprints, there's a really helpful tool here from the WWF that you can use the QR code, or we can post the link in after the session. But you can just Google WWF carbon footprint calculator, and it just goes through a quick quiz that helps you assess what your carbon footprint was for the year. And it starts to get you thinking about where that energy is coming from, what changes you could potentially make to help make a difference. Because it isn't just about what we do at work, but also about what we do at home as well. So when we're thinking about that carbon footprint, we need to incorporate that into our work practices. And what the Centres for Sustainable Healthcare, which is a charity organisation that is working with the Green NHS to produce educational materials, have come up with these principles of sustainable healthcare. So when we're thinking about what changes we could possibly make, it gives us 4 areas to consider. We can think about the prevention, which is where we promote health and preventing disease by actually tackling causes of illness and inequalities. We can consider patient self-care, so we actually empower patients to take a greater role in managing their own health. We can think about our service delivery and streamlining our care systems to actually reduce the waste within our patient pathways. And we can think about in what we buy and using low carbon alternatives. This might be in treatments or in our technologies that have a lower environmental impact. So if we are thinking about studies, thinking about potentially quality improvement and looking at even research studies for our trainees, these are some areas that you can think and develop. So where does that carbon footprint come from in pathology? Well, this figure again by the CSH really shows you a breakdown of those carbon emissions. And what we find is that lab is feeding into energy, into the fuels and electricity. The carbon footprint is coming from the instruments that we use, the transport not only of staff and our equipment, but our reagents and the patients that are actually coming to produce the samples in the first place, the gases we use in our methodology. And so we've got this whole system that's inputting into our carbon footprint of the pathology service. And I quite like this diagram because it really does give you an idea of how you can work out what your carbon footprint of your journey into work. And if you're going to a conference, it helps you consider your mode of transportation. At our university, we have we need special permission to use a domestic flight if there is train alternatives available, because as you can see, there's quite a difference between the grams of carbon emissions produced between a car, a bus, a train and a flight. So it gives you an idea. This is per kilometre, so you can easily work it out by your mileage. And what we want to try and ideally do is work to a circular economy model. So generally we have got into a really bad practice of buying something new that's been made from raw materials to then it being incinerated or landfill when it's discarded and no longer required. And what we want to do is try and get building this circular economy model, whether that's for our manufacturing, our consumables, our reagents, logistics or waste. What we want to try and think is, what can we refurbish with regards to our equipment if it becomes broken? What can we recover if it is no longer serviceable? What can we recycle in the materials and consumables that we use? Or if we can't reuse it, recycle it or refurbish it, can we repurpose it? Is a piece of equipment, it might not be fit for purpose for quality or health and safety regions within a lab environment, but it might be quite useful for a teaching tool. So there are lots of ways we can reuse and repurpose equipment and technology. And this slide from My Green Lab really emphasizes why labs are important in this environmental journey, sustainability, because we use 10 times more energy than an office space. We use 4 times more water than office spaces, and then labs across the globe produce 5.5 million tons of plastic. So that we have this need to try and think about and change what we do. So there's areas of focus in sustainability. You've got the ones linked to the environment, reducing waste and reducing the plastic usage that we have. We've got reducing the amount of water we use and thinking about the chemistry side of things, what the chemistry is environmentally harmful. It's about reducing the energy in our practice. But what we mustn't forget is those sustainable goals aren't just about the environment, but also we need to think about the health and well-being of our staff and patients. So linking into that, I advocate for the 6 R's. Let's reduce what we use so that we reduce the less waste and less energy. Let's recycle, repair, rethink, restore and reuse. So what opportunities do we have? Well, we've got, initially it's quite hard to reconcile that circular economy model with the healthcare sector. Single plastic items have their use. They're widely used because they're hygienic, And we've seen that, and we know that they are easy to produce. They have quite a wide functionality in the equipment, and so that we can get through the samples that we process daily. Also, energy consumption is unavoidably high. But can we, if we have the right partner, can we utilize greener energy options? Can we look at our suppliers and work with them so they utilize greener energy options? And so, in addition to making trust more sustainable, we need to think about this circular economy, because not only does it better for the environment, it has cost-saving benefits, and it boosts the reputation of your trust in your department. So we need to work with our healthcare procurers, because they can play a crucial role in stimulating innovation. It's through looking at our tenders, thinking about whether they have a sustainability agenda. And I've been working with a few suppliers more recently to look at what options are available. It's about looking at trying zero waste hierarchy and thinking about what we can eliminate or substitute. If it can't be eliminated, is there a bioplastic option that won't interfere with the quality of our results? Is there a way that we can actually process our biohazard waste that makes it less harmful and then can be reused in certain ways? And if products can't be safely reused or reprocessed, is there a local waste management that can allow, what can we consider, what capacity is safe to recycle? And it's quite useful reading this article by Malero in 2021. Who looked at the healthcare perspectives and considered what could we do in the lab. And I think that they looked at some research and considered that rational test ordering and thinking about the redundancy of tests that are no longer fit for purpose could be a way to actually improve the carbon footprint of the lab. If we think about getting it right first time, thinking about the error rate that can be up to 15%, if we can think about if we can reduce the overall throughput of samples coming into lab, then we can then reduce that carbon footprint and the plastic waste that we're producing as a result of those samples. If we think about the tubes, if we think about how much blood that collection is in a blood collection tube, how much do we need to have of that blood when we can get quite a few test results from a paediatric tube? I'm not saying that we should move all our blood samples to paediatric size, but maybe there's a happy medium that we can use a smaller blood tube, so we're using a smaller amount of plastic. Have we got policies in place of reuse of certain equipment? Have we got on-site recycling? Have we got a green purchasing plan? So there's lots of these ideas that we can maybe do small measures to consider within the lab. It's not about making big changes, and it's about thinking about the small things we can do. What can we encourage within our lab logistics? What can we do with promote with our staff for healthier forms of transportation? Or do we have cycling schemes? Do we have a steps competition? Do we encourage using commercial transport? And if we are thinking within of changes, making changes and quality improvement, this is where we can consider this SASQI. This is sustainable quality improvement. It's about thinking about the sustainable value of a change. It's looking at, if we're implementing a change in a patient pathway, does it have environmental, social, and quite often financial impacts? So it's another way of measuring change for our students that are doing projects. And if we are doing projects, we can look at the carbon footprint and where that carbon footprint comes from. We can look at the energy use on our site. We can look at the gases we use. We can look at the travel, as I've mentioned, but also thinking about the food aspects, thinking about our waste disposal. And then you've got the non-carbon impacts, thinking about the air pollution, the deforestation. Is there a way that we can incorporate increasing the biodiversity of our sites? Do we have space outside that we can make a green space that will not only have the benefits for the biodiversity, but also on our mental health and well-being as well? Thinking about what we use that might be toxic and what we could use less of or alternative. And I think it's important to remember that every test we run has a carbon footprint. This is the only data that we can find currently from McAllister et al. That actually associates a known figure to our tests in pathology. It's worth noting that these will be variable between labs, because you've got what equipment you use, where that equipment was manufactured and transported to the lab. You've got the manufacturers of the tubes. You've even got where that patient travelled to, how they travelled to phlebotomy, how many tests they had, how the distance from that phlebotomy or GP surgery to the lab. And so what we're working with at the moment is trying to come up with some carbon data to actually help some projects looking at reducing the carbon footprint of pathology testing. And GP Liaison Service is working with Lancashire hospitals at actually mapping how many samples come from different GP locations and how far they travel, to try and get some ideas for this. Because in the past, carbon emissions data has come from purchasing costs, so because it is so difficult to actually measure the energy used in a particular pathway or procedure. But so we're talking about energy. So where is that energy coming from? Well, we've got the lights. Have we got energy saving light bulbs? Have we got motion sensor lighting? What do we need to cool within the lab? Some of our labs have equipment that pumps out quite a bit of heat. And what's not so well known is that a lot of the companies can actually include a heat capture along with their equipment, so that you're not necessarily going into the lab environment and then you're having to use the aircon to cool that lab environment down. So that links into our fans and our heating. So there are lots of, and our computer usage. How many of us actually make sure that we switch off our computers over the weekend in rooms that are not going to be used? We've got our cold storage facilities, again by My Green Lab. There is not a lot of data out there that actually promotes or goes against the -80 freezer. So there's a lot of work still to be done to show whether the long-term validity of samples will be affected by changing your -80 to -70. But if we could change them, we can actually save about 30% of the energy consumed. Even if we can't change from -80 to -70, we can look at the fridges and cold storage that we do use. Do we maintain those fridges? Do we defrost them regularly and remove ice? Do we clean the filters when we're doing that defrosting? This can save 10% of the energy consumed by that fridge or freezer. And when was the last time we actually went through what was in those fridges or freezers? Some of those samples we may no longer need. So if we can clear up space, we might not need as many fridges or freezers within our labs. And if we can think of our plastic and polystyrene reducing measures. What do we order? When do we order it? Is there a way to promote bulk ordering with fewer shipments to decrease the transportation carbon footprint? Do we have recycling stations in all our laboratories or non-lab areas, for example? Or have we actually done an audit to consider what more sustainable practices we can have in place? And is there a way that we can decontaminate some of our plastic so that it could be reused for other options? And when we think about the water we use, do we have timers on do we have push down taps so that taps aren't left on? Do we have flow aerators to actually decrease the flow of our water? Do we actually make sure that if we're running autoclaves and dishwashers that we're running them as much as possible, as full as possible? And are we using the right quality of water for the right tasks so that we can reduce our carbon footprint associated with that generating that deionized water? And think about the chemicals that we use. Formalin has served as a routine fixative for over 100 years. And we know that formalin is not particularly nice. So are there alternative fixing agents? Well, protocols have been in place and validated and established to formalin. And some of the suggestions might not necessarily be viable for a clinical practice. I certainly wouldn't want to see any body bits in honey or other natural sweeteners. But there are some ethanol-based solutions out there, so work needs to be done to actually monitor the quality of using those fixatives. But no alternative fixatives has so gained wide acceptance. So if we can't change our fixative, is there a way that we can use vacuum packaging of samples so we can actually reduce the amount of formalin that we used? Another chemical we see in cellular pathology is the xylene. It's used as a cleaning agent on tissue processing and staining. The harmful effects of xylene are well recognised. So there's a lot of work going on to possible alternatives. Some of these alternatives are citrus smelling, and if you give headaches, they might not be possible. But we need to make sure that we are actively promoting change and thinking about doing research about what alternatives are out there. Other examples we need to think about is what is going through our labs. Here is an example from microbiology. They actually looked at the carbon emissions of the samples, and most of the carbon emissions associated with microsamples was either through personal computing or the consumables used. We're looking at NTU to consider unused agar and how potentially that might have a usage as a composting material, for example. So it's all about thinking about what we need, what we can reduce, and are we using the best practices. Here is an example of dermapathology, and in this study they were looking at alternatives to xylene, and they looked at paper product recycling, they looked at plastic recycling, electricity reduction within their lab, and what they found was there were considerable monetary savings by just looking at alternatives, looking at where they could actually reuse some of the xylene. And so it's all about training ourselves to question what we're currently doing. This is a great case study from Newcastle hospitals where they actually reduced the single-use plastics used in transport. How many plastic bags do we see going through the specimen reception on a daily basis? Well, the actual cost to the trust for disposal of those bags at Newcastle was about £5 per day. They also realised that the specimen bags did not comply with the UN transport regulations, and there was a significant amount of time removing samples from bags. So they actually had a project that looked at reintroducing reusable specimen transport boxes into GP practices and hospital phlebotomy services. Now, there was a considerable training impact on this because a lot of the checks that you do in specimen reception had to be done at the phlebotomy area. But there were lots of benefits for actually incorporating this training because the samples arrived in a secure and safe manner. There was improved confidentiality, and there was actual reduction in the risk of samples being lost because they came in this secure transport box. Also, time was saved in the lab because they no longer had to unbag the samples. So that improved the turnaround times of the specimens. It meant the results got out to the clinicians sooner. And also samples were less likely to be lost or misplaced. And it actually, because they were doing the checks at the front end, less errors were actually reported. So overall, you had that increase in quality, you had the increase and financial savings, as well as that environmental benefit to this project. And then you consider getting it right first time. And if we go back to that McAllister study and that carbon footprint for tests, if you think about a biochemistry sample that might have got left on cells or it's been taken into the wrong tube, you think about the error rates that are incorporated in taking a blood sample, when potentially you could actually use a point of care piece of equipment to get that result up. And quite often point of care equipment has reduced plastic, reduced water consumption, reduced energy use, and it's actually got a lower carbon footprint at the front manufacturing end. So because of that, in the right circumstance, under the right conditions, thinking about the quality and when it's fit for purpose, point of care can actually save the carbon footprint of the pathology service. So what are we doing in research? Well, it's quite useful to look at what researchers are doing, because some of these can be transferred to clinical practice. Can we switch off equipment not in use, so to save energy? Well, yes, we can. We can use timers to make sure that equipment is ready and available when we need it, but it also means that things are switched off when we don't. And a good example that for Lancashire hospitals is the incubator. You can buy a device on Amazon that actually measures the energy uses of a piece of equipment. And it was a support staff member that actually said this incubator that was left on 7 days a week only actually was used 1 day a week. So now the lab was actually able to turn it off for those other 6 days, and they had substantial carbon savings. Is there anything we can wash and reuse? This is less likely in a clinical environment, but it might be worth investigating what we actually use within the lab. Closed fume hoods, so that we can save that energy consumption. Think about certification, and I'll talk a bit more about this in a moment, but you can think about lots of these guidance documents are out there that can support and give you certification towards a greener practice. Is there a way of talking with your suppliers so that you're actually using the most environmentally friendly piece of equipment? Think about what you do in your offices, in your non-lab clinical areas. Have you got a paperless policy? Could you use tablets for your auditing rather than printing out that audit paper? Have you got recycling for general office waste? Do you really need to print something, or is it a digital version? Do you recycle your PCs at the end of their life? And do you utilize any sleep modes? Think about the meetings that you have. Yes, we know that there is a benefit to an in-person meeting, and we don't want to get rid of them as such. But could you have one in every 2 meetings virtually to save travel? Can you utilise working from home when possible for people that aren't needed in the lab? Do you have motion sensitive lighting in the office and meeting spaces? And can we turn off the equipment again? What about in our kitchen spaces, in our where we have our food? Is there a food waste collection that potentially could go to composting? Could we work with our local allotments for our hospitals? Do we have dedicated bins actually for plastics and glass in our kitchen areas? And do we promote glass bottles at meetings rather than plastic? And I mentioned about this certification. LEAF is one example of a framework that you can get bronze, silver or gold certification, and we've gone out to pilot this year of the clinical areas, and we're hoping to launch this across the board by the end of the year. And LEAF was a laboratory efficiency assessment framework tool that actually came from Universities College London. And Martin Farley is more than happy to talk to anyone that is interested about utilising this within the clinical environment. You've also got My Green Lab that offers training you can become a My Green Lab ambassador, which is a free training program. You've got the Freezer Challenge, which runs from January through to July, where you can actually turn down one of your freezers and compete for your energy savings. You can sign up to be an advocate for sustainable science, or there's also the ACT labels that work as environmentally friendly label, very much like you get your energy efficiency labels. These talk about the environmental impact. And they have also My Green Lab, they have their own certification that you could potentially sign up to. The work I've been doing with the European Federation, they have produced guidelines that are available for you to download to actually look at some steps you can take to be more sustainable within your lab. And this week they've launched their own certification program, so they're hoping to get clinical labs across Europe to as a financially viable option to certification. So you've got 3 potential options there for your certification. And if you want to know more You can join up to a network for clinical lab professionals to hear about the research that's going on, hear about the educational events that are happening, and also link with like-minded individuals. It's housed in the Centres for Sustainable Healthcare Networks, and it's been running for the last year, and we've got over 100 members now. And we're launching our first webinar event this month. So join the conversations, join the movement, and actually think about what you do at home and at work. And when you next send that email, think about the carbon footprint associated with that email. The average carbon footprint is about 0.3 grams of a typical email. If it's a spam email, that can be 0.03 grams just sitting in your inbox. Do you really need that newsletter? Do you really need to send that attachment? Because a large attachment can make the carbon footprint of your email up to 50 grams. And so think about what you're doing, think about what you're sending, and think about send less unnecessary emails, use links instead of attachments, copy less people into emails, delete your emails, and unsubscribe from your newsletters. Thank you very much. A lot of information there, and there's more readily available, but I'm happy to answer any questions within the time we've got left or after the session. Thank you very much, everyone.
Thank you, Sheri. If you could leave the last slide on, that would be amazing. I know Tahmina was just about to jump in as well. Just to say that this is a follow-up survey that we do at the end of all of our support hubs. So we'll leave that slide on while we have a chat and answer some questions. If you've got a device, you can click on the QR code and you can fill in the survey. It will help us to inform what we do next, but also specific questions and things you'd like support on related to sustainability. And then I think, should we go through the questions and answers that have come into me? There's only really been a couple as I've been monitoring the Q&As. One of them, Sheri, was, could people use your slides with permission to raise awareness of sustainability? So I thought the answer would be yes, but I thought we'd check with you first.
Some of them have come from My Green Lab, some have come from Centres for Sustainable Healthcare, but as long as we reference those to those organisations, they're more than happy for them to be shared, and any of my own, definitely, absolutely.
Lovely. Thank you very much. So another colleague asked if we share the video, and the answer to that is yes, we always share the video a few days later, so it will go up on the web page. Look out for that. It will appear, if you look for IBMS Support Hubs, you'll find the video. We'll just tidy up the start and the end, where we had some technical glitches with the poll possibly as well, but the rest of it will be on there. So we'll liaise with Sheri around the slides, and we'll make sure that people who've participated can get access to those. And the links that you've shared as well, Sheri, we usually do a frequently asked questions and point people to more resources as well. So if you're happy to help us get that together, then we'll make sure we do that for next week as well.
Absolutely.
Brilliant. Thank you. I can see a couple of things have come in the Q&A as we've been talking. So someone has asked, are there any ways labs in medical schools can reduce the waste?
I mean, they need to work with the university that's associated with the medical school, and I think a lot of the principles that the research and academic labs are way in front of the clinical labs. It's because of the quality aspects that I think it's a bit more tricky. But again, it's similar principles. It's about it's just having a walk round. Is this something we can do differently? Is there something we can reduce? It's about asking the questions and looking at more environmentally friendly options. So yes, in certain circumstances, there are gloves that are made from bioplastic. There are other bioplastic options for other things that we might use, but might not necessarily have been checked for our quality in the clinical environment. But that doesn't mean to say that if there's something there and you can do a mini study, that's great. I think it's just about asking the questions and having a look and reading through the guidance. There are lots of suggestions that I've not mentioned today, just because of time.
Brilliant. Thank you, Sheri. Another question has come in. Has the use of sample boxes instead of plastic bags been published? And what would happen in cases of leakage in the samples in the box?
It's not been published as a journal article, but the case study is available via NHS Futures, and I will try and fish out the link for that. I asked permission to actually share the case, but they were more than happy for me to do so. And as I say, if you join the right NHS Futures, and I can't remember which one it is, which group it is, but I will try and get that information across for everyone.
Yeah, so we can add that to the frequently asked questions, can't we? Any useful hints and tips on where to look, we can add that in. Emmanuel has asked about completing the form. So it should be the case, Emmanuel, that you can either type the link that's shown on the slide at the moment into your particular web browser, and that should take you straight to the evaluation form. Or if you've got a phone or an iPad that you can scan a QR code, if you just scan the QR code on this slide, it will take you straight to it.
I'm also getting the option to click on the link through the slides as well.
Okay, so I think if you go into that, it will just open the questionnaire for people, but that's the link. If you can't get that down and you would like that, if you drop an email into us, then we can make sure that you do get the link. So if you email me, it's Sue Jones, no dot, at ibms.org, and we can make sure that you get the link to fill that in if you're having any trouble, because we really value your input and feedback so we can make changes. So is there anything else, Tahmina? I missed anything in the questions and answers that has come in?
Yeah, we've just got one more question from Penny around the HCPC and whether they're considering putting sustainable practice awareness into its standards for registrants.
I'm not aware of anything. Sorry, Sheri. I've just jumped in. There's nothing in the standards of proficiency because they are my life at the moment. So there is nothing in there, but they are going to update the standards of education and training, but they've told me not for a year or two. So that's my awareness. What do you know, Sheri?
What I was going to say is, specifically on environmental sustainability, there's nothing named. But what I do with my students my apprentice students is link that there's the links through quality improvement, there's the links on equality and diversity, there is links on the research. So although there's no formal links, you can actually use those sustainability within the current standards that we've got. And there are certainly sustainable standards in the professional registration with the Science Council and through obviously the QAA benchmarks. So although the HCPC haven't got any sustainability named, you can do the links with current standards that we've got.
Thank you, Sheri. So if anybody isn't sure what the QAA benchmark statement is, if you've not heard of it before, it's what we ask our accredited programs to map to, so that they'll have that content in. So they will need to show that they're using sustainability in the materials that they're teaching with the students when they're talking about doing lab work, that kind of thing. So we will pick it up there from an institute point of view. But Sheri's right, you could talk about that in some of the standards that already exist if you give it that angle. So that might be a nice thing to put in the information that we send out afterwards, Sheri. Just a couple of examples of how you've done it before. Maybe give people some ideas for the reg portfolio of how you might get that in to meet some of the standards of proficiency. That might be really nice for people.
Will do, definitely. And I think especially with the leadership side of things coming into the standards, that because it's not it's slowly gaining traction, sustainability is something that you might find that the newer people coming into the lab want to lead on, because they're coming out of university. It's the future that's going to impact them the most. So they are driving this.
There's a couple of things come in. Emmanuel's just asking, can you get a certificate? We don't do certificates, Emmanuel, but what you can do for your CPD is you can refer to the video and do a reflection on what you learned by attending. So we don't give out CPD points or certificates, but your CPD for today could be reflecting on what Sheri has said and something you're going to do. Based on that. That will be a really nice piece of CPD evidence rather than a certificate of attendance. A couple of other things that have come in. What does Sheri feel is the most effective first step, and how do you engage with lab management to truly engage and overcome barriers? Great question.
I think for me, it's the education side. It's about sharing the information. It's getting the conversation started, because if you've got a lot of people doing something small, it can have as big an impact as doing a big change within the lab, which is harder to do. So I think it's setting up maybe just a conversation in the tea room about who's interested in sustainability. What do people currently do at home that can potentially be brought into the lab that isn't going to impact on the quality? And you, even if you just might think about, shall I have a vegetarian day once a week because it saves that there is a lower carbon footprint for eating non-meat? Or should I change the way I travel to work? Because if you get one person changing one thing for one day a week, it can have a huge impact. And that's, I think, why I recommend doing that WWF survey, because it really does show you what your own individual personal practice can do. Once you do it at home, and then you've got more of a momentum to then bring it into the lab. We are working with David Wells and the Greener NHS and the ACB and the RCPAth to try and put on an educational event for leaders so that we can try and get that top-down approach. But I think it's what can I realistically do in my own personal practice, in my own professional practice, that then can feed into what I do in the lab.
Lovely, thank you. And someone's made a suggestion that it's about current biomedical scientists as well as new and people who are studying, that it's about changing hearts and minds everywhere, isn't it? Which I think is something that you're definitely nodding your head at.
I think if we can just maybe bring in a 15-minute induction session into our, when a new member of staff comes in, if we could just incorporate it into one of our regular monthly meetings, that we have a sustainability in our agenda, then it would just start those conversations going. And there are some really easy quick wins when we think about the email, if we think about how we get to work, that kind of thing.
Yeah, lovely. I've just got an eye on the time. Are there any burning questions, Tahmina, I've missed, or did you want to jump in and add anything?
We've answered all the questions now. Thank you so much, Sheri. Can't see any more that have come through. No. And we have a minute left.
Brilliant. So we've landed our timing perfectly. Thank you very much. So we have just got a minute to go until 1 o'clock. Thank you so much, everybody, for joining us for the session today. Thank you, Sheri. Really thought-provoking. I think a few people have started to just think about some of the small changes and conversations they could be having to introduce sustainability. I think that's been really helpful. And the fact that people are asking about the resources and can they share slides, I think is a fantastic outcome for the session today. So thank you. Getting lots of virtual claps coming up the screen. So brilliant.